Hi, is that Paul?
Yes, it is. Good afternoon.
Good afternoon, Paul. This is Prem Mayan here. How are you doing today?
Good. Yourself?
I'm doing well. Thank you so much for asking, and thank you for joining as well. I'm really looking forward to speaking with you today.
Beautiful. Hopefully I can help you.
Great. So I think you had seen, Paul, some of the screening questions that were, a bit broad. So I'll just, kind of give my spiel, so to speak, here on what we're trying to accomplish here today, and then hopefully jump into some of the more detailed questions from there. Does that sound good, Paul?
That's fine.
Okay, great. So we're conducting a market research study right now on current as well as emerging treatments for binge eating disorder, looking at pharmacological therapies, obviously, but also behavioral therapies, digital approaches, really the whole gamut of different treatment options that are available for these patients today. And currently what we're doing is reaching out to industry participants and experts in the field to understand perspectives on what companies are doing currently to differentiate themselves within the space, any trends that you may see in the market, what opportunities do companies see in the space overall from a financial standpoint, how are they benchmarking success, and related issues. So we're not interested in any confidential or proprietary information, of course, and any responses you provide, just be assured that it would be anonymized fully and presented in aggregate in any reporting.
Okay.
So we had seen your biography that was shared with us by GuidePoint prior to the call, but it would also be great if you could voice over, Paul, your background and experience within the binge eating space in particular. That would be a very helpful context.
Okay. Well, as a whole, my background, I spent about 30 years in healthcare between, what was considered healthcare consumer, medical device, as well as pharma biotech, and in multiple capacities from operations to sales and marketing, both U.S. and OUS, to the past 10 years really driving on the pharma biotech side, the multi-channel, non-personal promotion aspects, all the digital therapeutics and innovation stuff that's happening. My experience is around binge is at my last company. We were in the process of launching a binge molecule, a drug that ended up, getting me a lot of experience because besides the molecule itself, it, as you're going through that, pre-commercial to commercial process, you really look at, what is it beyond the pill? What digital solutions can you offer? How do you need to educate, drive awareness, and change the paradigm to some degree, both with consumers and with physicians, as well as the insurance companies. So that's kind of where my binge experience comes from.
Okay, excellent. No, I think that's perfect. And I guess one of my first questions would be, based on your experience, how would you characterize how companies in the industry right now are looking at the opportunity for binge eating disorder? Obviously, there's adult patients that are diagnosed or may in some cases may be undiagnosed. So I'm wondering how companies are viewing the opportunity within the context of psychiatry. Is it seen as a small opportunity, a medium opportunity, a large opportunity at this point?
I think companies are looking at it as a legitimate mid-size opportunity with, I guess, big opportunity coming from that. And I say that because at least my impression of it is a lot of molecules that are out there either to address binge or that are looking to address binge are multi-purpose molecules. For example,